Hey guys, welcome back to the Finic Health YouTube channel. Today's video is about infusions and the different locations that they can happen. There are three common areas for a specialty infusion to take place. There is the home infusion, an infusion center, and an AIS or alternate infusion site. Today, we will discuss what each of them are and the benefits and drawbacks of each. This content is intended for nurses and patients seeking more information about specialty infusion sites. Let's start with home infusion. First, what is home infusion? Home infusion therapy is when a registered nurse is sent to your home to infuse an IV or subcutaneous medication. The medication and all of the supplies are shipped to your home from the specialty pharmacy, and then an RN is scheduled to meet you at your home to infuse that medication. In some cases, the RN's goal is to teach the patient how to self-infuse, or they will actively infuse and manage the infusion from start to finish. It all depends on the type of therapy that the patient is receiving. So, what type of medications do we infuse in the home setting? This can vary widely and ranges from antibiotics to biologic medications such as IVIG. Chemotherapy can also be administered in some cases in the home, but is more reserved for clinic setting due to safety concerns. What are the benefits of home infusion? There are several benefits to home infusion, and I'm only going to touch on a few here today. Firstly, the patient is more comfortable in their own environment. This leads to less stress and increased adherence to treatment regime. Second, the patient doesn't need to travel to get infused. Traveling to the hospital to receive an infusion can represent a barrier to many patients. The greater convenience represented by home infusion, especially for those with mobility challenges or limited access to transportation, are of particular benefit. The third benefit of home infusion is that the nurses can build a closer therapeutic relationship with their patients by developing a deeper understanding of their home environment and unique needs. This enhanced connection can lead to a more personalized plan of care and better patient outcomes. This customized level of concierge care creates a more therapeutic environment for the patient and encourages trust in their healthcare team. Home infusion nurses learn what their patients like and what they can physically tolerate with their infusions. Nurses can then customize the infusion to each patient's unique requirements. Home infusion patients tend to become attached to their infusion nurses and often think of them as almost like part of the family. This personalized care allows for the patient to have a better perception of the care they have received, leading to better patient satisfaction. Now, on the flip side, infusion clinics are equipped with more specialized equipment, like more advanced infusion pumps and monitoring equipment. Infusion clinics offer more resources as far as staffing too. There are often multiple nurses, pharmacists, or even physicians on site. These clinics provide a highly controlled environment, which is essential for managing more high-risk medications or patients. This includes chemotherapy patients or patients at high risk for allergic reactions, such as patients that have had an anaphylactic reaction in their history. For us as healthcare providers, these settings also offer a collaborative atmosphere where we can engage with colleagues and learn from the experience of others. Working in home infusion as a nurse, you typically are very autonomous and have limited interaction with your peers. Infusion clinics also provide a purpose-built environment that allows nurses to perform procedures efficiently and effectively. This optimizes workflow and patient throughput. However, this can lead to a major flaw in the patient experience. Oftentimes, clinics are attempting to move patients through their infusion as quickly as possible. These infusion clinics are on a schedule, and when infusions take longer, it backs up the entire schedule for the day. Nurses are often managing up to 4 patients at a time, leaving less time to work with individual patients. By having a schedule and limiting the amount of time a patient can infuse, patient satisfaction can decrease significantly. Patients often feel like they are not receiving the personalized care that they deserve. Not every infusion clinic is created equal though, and patient experiences can vary widely. If you have any personal experience with an infusion clinic, I would love to hear more about it in the comments below. Somewhere in between an infusion clinic and home infusion is an AIS, or alternate infusion site. This is a clinic-like setting that offers the feeling of an infusion center without the resources. The AIS will have infusion chairs, IV poles, and often offer some comforts such as TVs and snacks. The difference between an infusion center and an AIS is that an AIS, like home infusion, lacks the extra staff and access to advanced life support. Patients that are appropriate for an AIS would need to meet similar qualifications as a home infusion patient. AISs are great to allow patients the option to infuse outside of the hospital, but not have an RN come to their home. Important things to note with AISs is that patients will often have to have their drug and supplies shipped to their home and then transport their supplies and drug to the AIS site to use in their infusion. Typically, there will be one nurse to 1 to 2 patients at a time. An AIS allows for a personalized level of care and the concierge experience without having someone come to your home. This can represent a good option for patients not wanting an RN to come to their home and like the feeling of an infusion center without the hassle. Now, obviously my preference is home infusion. That's what we do here at Finical Health, and that's what we're experts at. But infusion clinics have their places with high-risk medications or complicated patients with several risk factors. Safety is the #1 concern in both clinics and home infusion, but infusion clinics are inherently safer due to their increased staffing and their proximity to advanced life support should an emergency arise. For the relatively stable patient that has limited risk factors, home infusion poses a much better option. This is due to the comfort of infusing at your own home, not having to travel anywhere, and the ability to build a rapport with your infusion nurse that can lead to a customized concierge level of service. Now, moving on, let's talk about costs. Home infusion can reduce overall healthcare expenses by minimizing hospital stays and related costs, making it a cost-efficient option for many. Meanwhile, infusion clinics can leverage economies of scale, potentially lowering the cost per treatment through shared resources. Many health insurance companies are realizing the cost savings available for home infusion and are now covering home infusion as a part of their regular coverage. I will say, in the case of home infusion, specialty pharmacies will often cover the cost of nursing as an expense of managing the care of that patient, even if the insurance will not cover the actual expense of the nursing. Either way, the patient should see little to no expense for the cost of nursing when dealing with specialty IV medication. However, the situation can vary depending on your insurance and the medication you are receiving. In conclusion, home infusion, infusion clinics, and AISs play critical roles in modern healthcare, each with its distinct advantages. It is important to understand the advantages and the drawbacks of each option and weigh your unique situation to determine what is best for you. As a nurse attempting to decide which environment you would like to work in, you have to decide which environment is, again, best for you. Do you want a more laid-back, autonomous setting, or do you want a more structured clinical setting? There is no right or wrong answer, only what is best for you. I hope this discussion helps clear up any questions you may have about infusion clinics versus home infusion. If not, please put your questions in the comments below. I would love to help you out as much as I possibly can. Please like this video if you got some value out of it, and subscribe for future content related to nursing topics, home infusion, as well as nursing education. Hit the bell notification to be alerted when we put out more content and never miss a thing. And as always, guys, thank you.